what advocacy is all about and really learning from great minds and great advocates, not just at the continental level in Africa, but also globally. And as we think about advocacy and as a faith-based church system, it is part of our calling. God calls us to take care and to be keen about justice, and especially for the poor. Proverbs 29 verse 7, the righteous care about justice for the poor, but the wicked have no such concern. So it's a mandate that God has given us. And therefore, I believe it's at the core of our hearts to really advocate. And because we are all Christians, I'm just laying the context. The Bible talks a lot about justice, and we have so many examples of great men and women who engaged in advocacy and ultimately brought great change to the communities they were serving. We know about Moses being told to go with a simple message, let my people go. Alone, confident, because God had told him, persistent, until he delivered the children of Israel. We know of Esther, became passionate, delivered the children of Israel. We know many of them. And therefore, even as we talk about advocacy, we are looking at it also from the perspective of our values as Christians, as people who believe in the Word of God. And therefore, I welcome all of us, even as we reflect, we also reflect on it from a spiritual perspective. And I hope by the end of it, we will be motivated to go back and to stand for justice and to stand for those who do not have the power to speak for themselves, and ensure that they have access to quality health services and also to quality pharmaceutical services. So this session will delve into critical issues of leveraging advocacy to ensure equitable access to healthcare services, transitioning from raising awareness to sparkling tangible actions. The session, we will commence it by having opening remarks from a renowned advocate globally and also at the continental level, Rosemary Mburu. And then we will also have a key session that will be looking at how do we communicate advocacy, because it is very important that we communicate as we are advocate. And we have Antoinette Muyuka from Perth who will be speaking to that. After that, we will have an able panel comprising of a young person, a faith leader, and also someone representing the Africa Christian Health Association platform, and also from one of our members here in Tanzania, CSSC. They will be giving us perspectives of how they are doing it, and I believe by the end of it all, we will learn a lot and we will be able to carry something. Then after that, please don't go. We will be launching a document and we will now be gearing towards the end. So I invite all of us to a very, very interesting session, the one that you will remember many days after we are done with this conference. So it's my pleasure now to invite Rosemary Mburu, the Executive Director of Waki Health and a global advocate, to give a few remarks and an overview on advocacy. Welcome, Rosemary.
Thank you so much, Jane. Thank you. Let us appreciate Jane, please. Since we are few in the room, we might as well clap so the ones outside there can hear the clapping and come and woo! Amazing stuff happening here. So thank you so much for the introduction. It's an honor to be here and to partner with EPN in discussing about advocacy. I am a great admirer of the work that EPN does, in terms of ensuring equitable, just, and compassionate pharmaceutical health services. And from an advocacy point of view, I have seen the power of voice, the power of speaking up. I have seen the power of influence, the power of relationships, the power of partnerships. And this particular session, looking at advocacy, is really taking us to that level of saying all the amazing work that EPN partners and stakeholders do in terms of service delivery. How can we actually also utilize the space we occupy, the influence we bring to actually address the root cause of the problems that we solve? So very quickly, I know many people here in the room have done advocacy in one way or another, and there isn't one particular definition for advocacy. There are many definitions out there, but there are a number of things about advocacy that we have consensus around. For example, we know advocacy is a process. We also know it's about persuading. And we also know the people you persuade or the people you target your advocacy to are decision makers. And you do this because you have a solution towards a problem that you want to solve, and they have the power to make it happen. We also say that advocacy is about changing policies and practices. And in one of the breakout sessions earlier today, we looked at policy actually and a bit of advocacy. So I think this is a nice flow from the breakout group. But I also wanted to mention that advocacy is different from direct service, where we know that direct service provides relief to visible problems, like what we do through the church health systems, or what we do at the point of care, or what we do in the facilities. But advocacy takes that a step further to now address, I had mentioned, the root cause of the problem and to seek to change them. What are some of the examples of problems that can be tackled through advocacy? As I was going through the poster presentations, it's amazing how many advocacy issues are here in the posters. But when you look at the poster doesn't say advocacy issue. The poster says recommendations. But when you look at the recommendation, quite a number of them actually can form a very strong agenda for the stakeholders, EPN stakeholders. And they are very much aligned even to EPN's vision and mission. And I'll just give you two very quickly. I went to one of the posters there, and it is a poster from the Commonwealth Pharmacists Association. And it was looking at how you can integrate leadership and antimicrobial stewardship and infection prevention and control into national health strategies. That stood out for me, because we are saying that we have national health strategies in all our countries. In those national health strategies, you do not have this integration of leadership and stewardship of antimicrobial and infection prevention control. That is already an advocacy agenda that is coming out of the conversations that we've been having here. There was another poster that really also stood out for me by Meds right here. It was around quality control, but what it was underscoring is the need to strengthen post-market surveillance and pharmacovigilance programs as vital regulatory tools to ensure that good quality medicines reach the population. So again, the whole issue around post-market surveillance, pharmacovigilance programs, tools around integrating these kind of strategies and programs to be core functions of regulatory authorities or regulatory body frameworks is really amazing. So in this room, there are so many advocacy issues, advocacy agendas and recommendations. And in addition to those two that I picked from the posters, here are others that, as Jane has mentioned, we will be looking more into EPN strategy, advocacy strategy, but some of the key things that already from the conversations here and from the work you have been doing form really good examples of what EPN and stakeholders, all of us in this room can tackle include funding and affordability and rising cost of healthcare. One of the biggest problems we have in the region, in our countries, is around funding. How can we ensure that funding for quality and affordable medicines is part of our advocacy agenda? There is also an element, and I know we've had this conversation with some of you along the corridors here, the whole issue around church health systems and the government health systems and the interaction between the two. And looking at how can, you have an advocacy strategy or agenda that seeks to bridge the gap and to close this gap. We see, for example, in many of our countries today, our governments are working on the social health insurance. And when you think about social health insurance and the benefits and where those benefits actually manifest is mostly in public health systems. So why this gap? And that really is an advocacy agenda in terms of minimizing or strengthening the integration of church health systems with national health systems. Another one is increase of substandard and falsified medical products. We are seeing that. We have heard about that throughout the sessions here, and that's an example, an advocacy problem. Availability and affordability of quality pharmaceutical services and medicines. There is also a lot of talk here in our region around local manufacturing, local production, making sure that Africa is not the last on the line when we have the next pandemic, making sure that we can actually strengthen our infrastructure for manufacturing and local production. And that's an agenda as it relates to availability and affordability of medicines. We have talked about the antimicrobial resistance being a growing challenge, the whole issue of lack of equity. I like the theme of this forum. The theme of this forum, Bridging the Last Mile, is really about equity, is about reaching the farthest, is about leaving no one behind. And that's an advocacy agenda. And it has some dimensions to it, because the question is, why are some people not accessing health services? What are the limitations? What are the barriers? And how can church health systems address those barriers or bridge those barriers? The first thing is that church health systems, as per literature and as per the reality on the ground, because church health systems are really the facilities you will find in the smallest, tiniest village, all the way to the last mile. There is a faith-based health facility there. And so being out there, reaching the people, being in the community, serving populations that are underserved by the national health systems. But there are other dimensions. For example, some people in the population are left behind because of issues of gender inequality, issues around rights, issues around the type of community they belong to. And given that church health systems actually have, at the core of it, compassion and justice, it really is a great, I think, opportunity, and church health systems really well positioned to drive this kind of agenda. Then you have health systems shocks, such as pandemics, such as climate crisis. All these are, intersectionalities that either contribute to weakening health systems, or based on how we address them, can help us build resilient health systems. Moving on very quickly, a few key words when you think about advocacy, and I wanted to speak to this in relation to church health systems. So we have, what I just went through are some of the issues, some of the problems, some of the challenges that church health systems can address through advocacy. We agree that, we do that because we want a particular change. We agree that it is a process. It's not an overnight job. We agree that we need to present ourselves to decision makers. We need church leadership, church health systems leadership. This voice, we need it in front of decision makers to bring all this intel that we are gathering from the system, from the community, from the last mile, to be in front of decision makers so decisions can be favorable to the reality on the ground. The power of voice, the thing is that church health systems are quite trusted by people. People trust, and people say, oh, I'm going to the St. Anne, I'm going to this other one. So there is that in terms of there is a voice that you can mobilize, not just for services, but also for the change that we want to see. So for you to then make a change, you need to educate. You need to educate the decision makers. You need to educate other advocates so they can understand why this issue is important. What does antimicrobial mean? Why is it important? Why should I care about antimicrobial? That education, because it is also technical. These things are also technical, so that education is very important. Evidence, facts and data. One of the things that is standing out for me during these conversations is the scope and how broad and the kind of coverage church health systems have. And every day you access data. Every day you see evidence of where service is lacking, service is needed, what the challenges are. And that data, that evidence, those facts are very important for the change, and then presenting them in a persuasive way. Influence. I also see that church health systems have influence, especially because of the faith leaders. The faith leaders. One of the things in many of our countries is that for people of faith and for people who see a particular faith leader as their true north, in many cases, when they say wash hands, people will wash hands, isn't it? Am I telling the truth? When they say wear mask, people will wear mask, isn't it? I'm really saying how influential the pulpit is, and how we as congregations actually are very much aligned in terms of our behavior change to the messages that come from our faith leaders. So influence, and that can contribute a lot to the advocacy and to the change. Relationships, it's about relationships. You can do an advocacy activity for 3 months, trying to go and knock on the door of the decision maker, and then one day, Richard, our executive director, just wakes up one morning, goes, knocks, and bam, he gets the signature. Influence and relationships, because there is also that level of credibility, and people leverage their relationships, and people help people they know. Actually, people open doors based on the relationships they have built. And I think church health systems, just by that characteristics, can open so many doors for the rest of us. Partnerships and visibility. Visibility is important because there are so many competing priorities. You can imagine we've been here for 2-3 days. We are talking about antimicrobial, we are talking about regulatory, we are talking about quality, and so on and so forth. You can imagine the issues that are coming out of this space. There is another conference going on somewhere talking about universal health coverage, local manufacturing, climate crisis, and so on. The issues are so many. And therefore, as a decision maker, I'm cut and torn between how do I prioritize this. And a lot of times, the decisions are made based on the visibility. I don't know how many times we've gone to a decision maker about a particular budget, and why did you not put a budget for TB, for example? This is a real example. Why did you not put a budget for TB in this budget? And he says, but nobody told me. Nobody told me to put the budget. And you put so much for education, but the education guys were here every day. And so it is also about visibility. So, and church health systems and people of faith, we are shy about, blowing it up there and saying, this is what we are doing, and really coming out strongly to raise our flag high. And I think we need that, because I think that also we need to show our value, our strength, and even as we negotiate with our national governments to say we need a seat at that table that is making decisions, we are coming to say, look, we have all this data, we have all this membership, we have all these constituents, so there's so much wealth, we need to raise it up a bit. So we have gone through this in terms of what makes church health systems unique when it comes to advocacy, the broad network. Like I think about EPN and the membership, you all do amazing work. the trusted voice, the credible voice, access to data, influence by faith leaders, the visibility, the last mile, and representation in decision making. So the last thing here is to say that, almost last, is that advocacy is teamwork. Teamwork. Even if the EPN Secretariat wanted to do all these things, they couldn't do it without the membership. They couldn't do it without everybody. So some people here will come with the funding. Other people will come with the technical capacity. Other people will come with connections to where the voices are. There's something everybody is bringing. So it's teamwork. And the core values within that teamwork includes ensuring that there is trust in that team, there's innovation. Advocacy is also about trial and error. Sometimes we try something, it fails. We try the target, it doesn't work. It's really keeping the spirits and trying and keeping going. Responsibility and so on. And finally, all advocacy is, at its core, is an exercise in empathy. I like this quote a lot because a lot of times advocacy is passion. Advocacy is about compassion. Advocacy is about justice. Advocacy is about making something right that is wrong, something that you would do even if nobody paid you to do it. And therefore, is an exercise in empathy and very much aligns to the vision around compassion and justice. So I will leave it there. There are so many more conversations, and thank you so much, and really encouraging all of us to embrace advocacy. Thank you.
Wow, amazing. Wasn't it amazing? Please let's give her a better hand. If we were in church, I would have asked us to stand and sing a song so that it can sink deeper. But now because we are in a conference, we will need to proceed. And amazing things that have been said. And really speaking to what we have the trust, we have the reach, we have the expertise, we have the coverage, we have the structures, we have the facilities, we have the platforms, we have the influencers, the pulpit. And I'm just wondering, how do we galvanize the efforts and increase our visibility as a network in terms of advocacy? Because it's also been mentioned that we're already doing it. But how do we galvanize our voice and really make the world know what we are doing and how we are doing it? I think we can bring, the next conference, we can bring the whole of, Africa to this place just to hear and see the great things that we are doing. And I'm hoping that as we go by, we'll start thinking of how we can bring our efforts together and enhance our visibility. So we'll hear from the next speaker, and she will be telling us how do we communicate advocacy. Over to you, Antoinette Muyuka from PATH. She's the communication specialist at PATH to give that presentation.
Good afternoon, everyone. I'll just get into it. I'd like to ask us a question. How many of us are married? How many of us are married? How many of us are happily married? What is the secret to a happy marriage? Communication. Whether she's annoyed, you have to tell her, I love you. It's an instruction from the Bible. Whether she's happy, whether she's sad, you have to tell her, I love you. She can be throwing at you everything because she's annoyed, but you still have to tell her, I love you. That is what communication is to advocacy. The secret to successful advocacy is communication. Because you have to say, you have to speak. We have a problem. we have the evidence, we have the solution. What we do not have is the message. So I work for PATH. Interestingly, our mission is to advance health equity through innovation and partnerships. Keyword here being equity. We have done so much. We prepare and respond to emerging health threats. Currently, we are working with Africa CDC on MPOX. We improve lives with science and technology. We do a lot of that. If anyone speaks about PATH, a lot of the times they'll tell you malaria, diagnostics, research, and all that. And then we increase health system capacity and resilience. Yesterday, there was someone who spoke about digital health in Tanzania. We have an office in Tanzania that is leading on that. So our areas of geography in Africa are up here. I work for a department that is called Advocacy and Public Policy, and a lot of our work is focused on research and development. Why? Because a lot of this work is being done. We have done so many trials. We have done a lot of research, but are there policies in place to make sure that when you're talking about local manufacturing, when you're talking about, let's say, improving manufacturing policies, improving manufacturing and producing our own, let's say, diagnostic devices, do we have policies in place to support this? So I'll be going quickly through this just to give you a background of what PATH does. For the section that I work with, a lot of it is focused on improving pharmaceutical manufacturing policies, making sure there's regulatory harmonization in place. We support a lot of countries to ratify the African Medicines Agency Treaty. And then we do a lot of accountability, making sure that a lot of accountability mechanisms are established for the African R&D ecosystem. So when we talk about advocacy, this is how we approach it. Like I said, advocacy and communication cannot be separated. A lot of what Rosemary has said is basically what we do. It will look a lot similar, but in this context, we are going to look at communication. So the first pillar is on evidence generation and packaging. You have to put communication messaging for people to, one, it has to be interesting for the people, and two, you have to put it in a way that people understand. I'll give you an example. Kenya, where I come from, has like 47 governments, county governments. In one of the counties, they had a problem of teenage pregnancy. And when we went to the county leadership to tell them about that, they told us that is not existent. Why? They had not been given the data. We took the data to them. They told us this data does not make sense. They still denied this until we had to get some time, get the county leadership out of that office, take them to the facility, the health facility, so that they actually see that teenage pregnancy is real. When we left that health facility, they came back and they were like, give us the data, that we have to do something about teenage pregnancy. So how do you present this evidence to the decision makers? It really matters. The second thing that we'd look at in our advocacy approach is policy landscaping and analysis. The third one is champion building and engagement. The beauty about the church is a lot of people will listen to you. If you're looking at decision makers, whether they're influencers, whether they're advocates, whether it's the politicians who are supposed to pass these policies, they come to church. They're our congregants. At that time, you're in a position to influence or give them an opinion about things that we want to put in place. And then the second thing that we have to do, we have to identify trailblazers or people of voice who come to our churches to be able to share this information with the decision makers. If the politician himself doesn't come to church, probably his family does. His wife is a member of Mothers Union. When you train her to tell her, this is a challenge that we have, we need you to be a voice leader or give us your voice in this, what will happen to that influence is she'll go back home and talk to her husband, or he will go back home and talk to his wife, who is a decision maker, about that problem. And then we also have to look at advocacy messaging. There are very many ways that you can do messaging. The secret is identifying what your audience prefers. We can do opinion pieces. For those people who read newspapers, we will have to write to get the message to them. TV, radio, for people who listen to that, just to pass our message across. We can have media breakfasts so that the people who, we also engage the media for them to get our message. The thing we have to do is use the right channel to communicate to the different audiences. We can't use one specific channel for everyone. And then under advocacy and messaging, there's a lot of strength in coalition building. You have to work together, build a community of practice, so that you share what works for you and what doesn't, so that anyone else who's probably starting an advocacy activity or something like that does not make the same mistakes that you do. And then looking at our advocacy theory of change, I'll just rush through it, but these are the areas where communication works for us. You have to have a targeted list of decision makers so that you know who you're communicating to. You have to ask for technical assistance. For most of us, we might not have the budgets for communication people. So there are a lot of organizations like PATH that are willing to give technical assistance to different other organizations on communication for advocacy. And then we have to be keen about our evidence generation and packaging. We have to train our influencers. In this case of the church, a lot of the church leadership, we have to tell them how to speak so that they are politically correct. They are talking in a language that advocates understand. And then for the immediate outcomes, when we do our advocacy right and get the communication right, you'll find that you'll have a lot of political support, and there'll be a lot of increased use of evidence. So when you put yourself correct, using the messaging, if you put yourself correct as an advocate, you'll find that people often come to listen to you. I'll give an example of PATH. People keep telling us, we keep saying what we have done. We are always saying what we have done. But the reason is we are positioning ourselves as a leader in the advocacy space. You have to keep saying, this is what I've done, this is the evidence. This works. I have done this, it has worked before. If we do this, it will work. That is usually the way you structure the messaging for a winning advocacy strategy. And then I'll pass through this. You have to measure the impact. For communication, you have to measure the impact. How many people read our message? How did people perceive our message? What was the lesson that they learned from it? How many decision makers were engaged? How many events have we organized that made this advocacy activity successful? We did a media outreach. What was the outcome? You always have to go back to measure the impact. Unfortunately, as a communication person, nobody claps for me at the end to say, you did a good job. They will just come back and say, 77 policies have been adopted. That is the end result. Again, I come back to the part where when your wife is happy, nobody will remember that you told her you love her. People will just be saying your wife is happy and you're a good husband. Nobody remembers the effort that you put into it. And then this is a summary of some of the policy outcomes that we have done using the advocacy and communication strategy that we've had. In the lessons learned, I want to, if you forget everything that I've said, I want you to remember one thing. If today someone who has been giving us funding comes and asks, we need to slash the budget, who will be the first victim? the communication people, because nobody ever looks at why is communication important. Even when you're doing work planning, even when you're doing budgeting, we always do budgeting for everything else. And then when we want to start is when we remember we have a launch. Who is going to plan for the launch? Then that is when we remember we do not have a communication person. We do a lot of technical work. Most of the time, people who are doing communication do not know the technical background of the work that we do. If you do not start with them from the beginning, from project inception to the end, you're going to bring in a communication person in the middle and miss out on the key messages, or they won't have a proper understanding of what you're trying to communicate to external audiences. And you have to be very strategic with your communication. You have to look at your audiences and know what works for them. And communication is very simple. There is nothing out of the ordinary that we do as communicators. We go back to the basics. We write, we read, we put pictures, and that is how we efficiently communicate and integrate a little bit of the modern world. If we ask today, how many people have received a forward from TikTok? Everyone will be raising their hand. But we are so afraid to use it as a channel for advocacy. We also need to look at the youth, for example, love TikTok. The older people read newspapers. You have to identify what pleases your audience. I think this is my last slide. The other thing that I have to say is that we need to document a lot of our work. If you go to the PATH website, a lot of it has documented everything that we do. That way, you position yourself as a leader in the advocacy space. Thank you.
Wow, amazing. Let's give her a better clap. Thank you, thank you. Thank you so much. And if you forget anything, remember, communication and advocacy, they are one and, we've been told is husband and wife, eh? You cannot divorce the two. We must ensure that as we advocate, we are also communicating. And she has really brought out very key issues: evidence, messaging, coalition building, measuring impact, having clear channels of communication, and documentation, which is very, very important. We really appreciate and take our regards to PATH. So we now go to the panel, and we have a very interesting panel, as I said earlier. And to start off, we will have a young person. In Kenya, we call them Gen Zs. Yes, the young people in the house, you are well represented. And he will start us off. And Michael Mosha, we want to hear from you. You introduce yourself and you tell us what you are doing currently in terms of engaging in advocacy in 2 minutes.
Good afternoon, everyone. Yes, Michael Mosha. I'm a pharmacist by profession, and I'm a member of the quadripartite working group on AMR, but also I represent African Youth Task Force on AMR. I work at RBA Initiative, that's Rollback AMR Initiative here in Tanzania. Majorly what we do at RBA Initiative, we advocate, educate, and conduct research on AMR, whereby we engage the youth, but also different cadres in health. And we work with several professionals, including the policymakers themselves, and happy to have joined this panel. Thank you.
Thank you so much. Next, we will have a faith leader. Remember, we've been told they are the influencers, and we can use the power of the pulpit. So we have Reverend Charles Berahino from All African Conference of Churches. Please introduce yourself and tell us what you are doing in the area of advocacy.
Yeah, good afternoon. I am Reverend Charles Berahino. I work with the All Africa Conference of Churches as Executive Secretary for Peace and the Diaconia. I'm of course here in that capacity of Executive Secretary in charge of Diaconia. So the All Africa Conference of Churches is trying to mobilize its member churches in the African continent to raise their prophetic voice as far as issues around health are concerned. Thank you.
Thank you. Next, we have Peter Maduki, our host. Peter is from Christian Health Association, Christian Social Services Commission. Please go ahead and introduce yourself.
Bon après-midi. My name is Peter Maduki. I'm Chief Executive Officer of Christian Social Service Commission. Christian Social Service Commission works on in regards to advocacy for having conducive environment for providing healthcare services by the church through engaging itself in development and the review of the policies, monitoring their adherence, and also building the capacity of the healthcare workers or professionals so that they can participate effectively in the advocacy. Thank you.
Thank you and welcome. Next, we have a representative from a civil society organization, that is ACHAP, Africa Christian Health Association Platform, Dr. Alex Muhereza. Please introduce yourself and tell us what you are doing or ACHAP is doing around advocacy.
Good afternoon, everyone. My name is Alex Muhereza. I lead programs at Africa Christian Health Associations Platform, which is a network of national Christian health associations and church health networks. And the work we do is to support the national Christian health associations in participating and delivering service delivery, health service delivery at national level, but also together as a platform, amplify the voice of the faith-based sector in various aspects of health. So the work we do in advocacy is quite a lot in terms of engaging both the community, the national level, but also engaging other platforms, regional and globally, to ensure we amplify the voice of the faith-based sector. Thank you.
Thank you so much, Alex. And last but not least, we have another civil society organization representative from the Global North, Julia Stoffner from Bread for the World. Introduce yourself and just give us a short overview.
Yeah, thank you for having me. My name is Julia. I'm responsible for global health policy at Bread for the World, a German NGO of the Protestant churches. And I first have to say two things. I'm really impressed about your efforts and your energy to improve faith-based organizations, to improve healthcare services and pharmaceutical supply chains. So all the topics we were talking about the last couple of days. But you never blamed the global north for your challenges. You are seeking solutions within this within the current scope of work. So I'm happy to be the bad cop today, and I want to focus on some global structural problems caused by the global north during this panel. And this leads me to my main focus of work, which consists of two topics. The first topic is access to medicines, including local production of vaccines and medicines in Africa. And the second topic is active recruitment of healthcare workers. And why did I choose these two topics? Because the German governments harm the global south. So, for example, the German government